Okay. And so the other thing is, if you are confident, so hello everyone, if you're watching this live right now, Brittany and I are getting set up because we are streaming on multiple platforms, and that's a little more tricky than streaming to one platform. So if you are confident that you are streaming on Facebook and you don't want to deal with the delay while we talk to each other, then you can come back to the actual platform that we're in, and then we can just keep checking back and forth. So if anyone watching is posting comments or asking questions during this live stream, just know that we will be going back and forth to check on those things. So if we don't see it right away, it's not because we're ignoring you, it's just because we're having to go back and forth, because it's a little more complicated. So also, hello everyone. My name is Amelia Borland. I'm an occupational therapist. I'm the owner and founder of Higher Standards Caregiver Training, and I am here with Brittany Lamb today, who is going to give herself a introduction in a little bit here. But just a quick overview of what is happening right now. So Brittany is an ER physician, super experienced, crazy smart, and I was lucky enough to meet her, and then we recorded just the other day actually an episode of the Caregiver's Dilemma podcast, and she and I had such a great conversation. We thought that it would be really cool to continue this in a live format to allow other people to ask questions and participate if they want to. But this is just a super informal discussion of how caregivers, and really specifically how caregivers of folks with dementia can better work with the care team, the medical team, and care providers in order to help make sure that providers are able to give the level of care that they want to give. So I'll stop talking now and let Brittany introduce herself.
You're fine. You did so good. So we were not live, but we are now. I guess I needed to press the go live button. So hi everyone who's watching. Now I can see that there's two people, and I'll see if there's any comments or anything. But yeah, so my name is Brittany Lamb. I'm an ER doctor, and I care a lot about dementia caregivers and their journey through caregiving and being able to make good and confident medical decisions on behalf of their person. So that's the work that I do these days, and I'm so glad that I found Amelia, and I'm glad to be here and have this conversation with her. So, and I think that her perspective as an occupational therapist is going to teach me things. So I'm excited for all of us to learn some stuff on this chat.
Yeah, and so for anyone who's watching through Brittany's group, so you obviously know who Dr. Lamb is, but you have no idea who I am. So as Brittany said, I'm an occupational therapist, and I've been an occupational therapist for over 10 years, and I've worked with adults and seniors from all walks of life and in all different kinds of care situations, whether it's rehab, skilled nursing, long-term care, memory care, acute, ICU, you name it. I've kind of been there. And one of the things that I always wanted to focus on and that I always noticed was just how difficult a task it is, one, for caregivers to do the incredibly difficult job that they have, but also the limited number of resources and the limited amount of time that providers have to actually share our knowledge and resources with you. So that's primarily what I do now, is I help caregivers with practical kind of information. So anyway, I think that a good way to start a conversation about, the title of this is how to help your care team help you. And I think we should probably start by just acknowledging the point of this conversation is not to put all of the onus on the caregiver or all the responsibility on the caregiver. It's really about acknowledging, though, that having better communication is better for everyone involved. So, but Brittany, what do you think when folks walk into your ER? What are some of the big problems that you see that make it harder for you to care for the patient?
Yeah, there's multiple things. I could probably talk about this for a long time, but I think two of the biggest things are time constraints, like you mentioned. I think that, depending on what the level of volume, and that's what we use to tell us, like, that's our term for how many people are in the ER, basically, how many patients do we have. If the volume is really high, it can be very hard to spend a lot of time in each room. And so that's a huge barrier, and not one that I can really, off the top of my head, come up with a fix for, to be honest. That's just kind of, that is what it is. And then I would say, like what you mentioned, there's communication issues. And so I think that's the other biggest thing, is it makes it challenging to kind of get to the root of the issue that's going on and help someone, because we're not communicating on the same level. And I think part of that is what I need from folks so that I can help you is, to one, I need to know that the person has dementia. I think that's a big thing. And then two, I really need to know what the purpose of the visit is. Like what your intention is behind coming into the emergency department. And I'll just real quickly say, obviously sometimes people come into the ER and, they came by ambulance, they fell down. It's obvious why they're there, but, or they're very, very sick, they're critically ill. And so we don't really have time to say, why did you come here when you're having trouble breathing, right? That's a different issue. But sometimes people come in because they are having trouble at home. They can't get their person out of bed safely and they called an ambulance. Their behavior is such that they're not able to handle this. And so I think that the communication is a huge thing. So what the intention and the purpose is, and what someone is looking for help with, like, I need to know that, and I just want you to tell me, like, right away, so that I can help go, okay, that's something I can actually do, or that might not be something I can do, and I need to point you in another direction or get some other people to help me help you. So that's like the big thing I can think of off the top of my head.
And I think, that's so interesting to me that, like, the first thing you said is, let me know that this person has dementia.
Yeah.
And I think they're like, and I don't know how helpful or insightful or even correct this will necessarily be, but I think sometimes it's important to understand that, one, all of our healthcare records don't communicate, right? So if you are seeing a primary care physician that's not in the same system as your surgeon or your emergency physician or something like that, all of those different providers, if they're working in different healthcare like organizations, they can't necessarily view the records that you have from other hospitalizations or other doctors or things like that. So even though it seems like, gosh, shouldn't they just know this already? Sometimes we can't, because we just don't have access to that information. And I think maybe the other thing too about letting people know that your loved one has dementia going into the ER is, I think that we recognize the ER is a pretty scary place. I mean, hospitals are scary places, but ERs are the most intense of that for the most part. It's like the ER and the ICU; those are the scariest places, right?
That's what I would say. Same thing.
Yeah. So if the people around you and your loved one know that your loved one has dementia, that will allow everyone to adjust as much as they can within the parameters of that system, to make sure that they are speaking with your loved one in the right way, that they are behaving with your loved one in an extra calm manner, and that as much as possible, people are going to try and accommodate that, because as crazy as it can seem in those situations, people do want to try and communicate and accommodate you as best as possible, because it makes the job easier, and it
makes everything easier if we're all talking from the same place. We all have that understanding. 100%.
And also, just like from a medical standpoint, there are so many reasons that someone might be confused, and dementia is actually like one of probably 100 things on the list that might mean might be a reason that someone is confused, right? So if we know that someone has a baseline of confusion, that's really helpful in determining what may or may not be going on with someone.
Yeah, I think it's important to tell everyone who also goes into the room. So, and this you can use this for any clinical setting, any part of the hospital, outside of the hospital. But anybody who enters that room and is interacting with your person, unfortunately, what's going on behind the scenes, which you can't see outside of that room, is a lot of times people are doing different tasks and they have different roles and responsibilities, and they don't always get to talk to each other and debrief before they're going in and out of rooms. So I've had rooms that I've gone into where I know the patient. I'm the one that's being told that they have a diagnosis of dementia, and I go to find their nurse to tell them, oh, that's why they acted that way. That's why they did. That's why this happened. That's why we had that interaction, and I can't find the nurse. So it's that, and also we have techs, and that's the other position people should be aware of. In the hospital setting, is that we have folks that are highly trained, people who get blood and start IVs and put people on monitors and get EKGs and do a lot of the face-to-face interaction with patients. And they need to know too, because nurses and techs, they spend more time at the bedside. We all know this, right? As a doctor, I go in, I see you, I put in my orders, and then they do the orders, right? And then I come back and tell you what we found, or come in if we need to change the plan. And then when we have what we call a disposition at the end of a visit, when we know whether you're going home or you're going to the hospital or wherever you're going, I go in again. So the folks that are in the room a lot need to know. Like, you can't just tell the doctor, you can't just tell the nurse, like, just tell everybody. And I think that there are ways that you can do it, and your person better than we do. So you might need to subtly pass us a note, a business card. There's stuff you can look on Etsy. There's products that you can buy that say, hey, be careful, my person has dementia, like, give me some more time, please understand their odd behavior, or outside of the norm behavior. But it's also good to let us know too, because I want to make sure that that's in their medical record. And sometimes, like you said, our records don't communicate, and so it won't be in there. And for me to know that they have a diagnosis, I'm not saying that people who are diagnosed with dementia can't make their own medical decisions, because towards the beginning of the disease, they often can, and they often have the ability to do so. That kind of comes and goes. And you want this person to be involved. If they can put in their 2 cents about how they're feeling and what their preferences are, they should. But it's a big tipping, not a red flag. It's not a red flag, but it's a flag for me to go, okay, if this person doesn't really understand what I'm talking about, like, what the plan is here, there's someone else I need to talk to, and I need to make sure that person, is the right person I'm talking to. So yeah, it's so important to tell us, and that it just seems like something that would automatically happen, and it just doesn't.
Yeah, we wish it would, but it just doesn't. Also, this is off topic, but quick shout out to the techs out there, because we know that you make the world go round, and you guys make or break the experience of the people that we care for so much. So thank you so much. I've always said there's nothing better than an amazing phlebotomist.
Yeah.
I mean, no one is more delighted to see anyone than well, first of all, if you're a phlebotomist, no one is ever delighted to see you until you leave when you're great. And then you have made that person's day by being excellent. So anyway, that was off topic, but shout out to all the techs out there for making the world go round.
Yes.
So I think that, getting into this idea of communicating, letting people know what's going on, one of the issues and one of the questions that often comes up for people is, especially in, certainly in like emergency healthcare situations, but I really think in any healthcare situation when people are, faced with a doctor or a healthcare provider, a lot of times people either they don't know what to ask, or they don't know what to say, or they feel intimidated about speaking up. Or I've often had my own patients or my own clients tell me, like, you know, because as a therapist, I have the privilege of spending a lot more time with people than most doctors do. So I get to know them better, I get to have more conversations, and ultimately they end up sharing more with me just because I'm there for more time. And I'll say, like, hey, you know, let me tell the doctor about that, and, you know, next time you should feel like it's okay to tell the doctor about that. And a lot of times, you know, they'll share with me that they just didn't feel comfortable doing it, or they didn't even know what to say or what to ask. So, you know, as a doctor, like, what's your advice for that?
Yeah, I mean, well, I'm not saying that every doctor is a good doctor. Let's just put it that way. There are ones out there that are not great, and there's also, you know, if you don't, I tell my patients, if you don't have a good relationship with your doctor, then you should really consider getting another one. If you don't feel comfortable enough to talk with them, then, you know, you can find someone else, and you can sometimes ask to see someone else in the practice, where you can switch practices. And I always tell people to make sure that you've lined up another doctor before you switch, because this day and age, people are waiting a long time to get into new offices. But listen, it's your health, it's your body, you're taking care of your person, you're their advocate. Like, if you can't speak to their physician, then you might need to think about making a change. I think that one thing that people can do to make themselves feel, and also the emergency department, you can't ask for another doctor. Let me just put
you
can't do that.
You're gonna get what you get.
One doctor.
Yeah.
Sometimes there's only one doctor. I will tell you that if you are really uncomfortable with the care that you're getting from a physician assistant or a nurse practitioner, there should be a doctor there supervising them and talking with them about the case and everything. So you can always ask to see the attending physician, like me, but you can't ask for a different doctor. It just doesn't work that way. You know, and in the hospital too, you can't pick your doctor. You know, there's hospitalists, and so I tell people that, you know, first I say kind of kill people with kindness. You know, if you attack a doctor, you attack a nurse or a tech or any member of the healthcare team, you're immediately going to put us on the defensive. And people are stressed out, burnt out. We have very hard jobs, and so when people are aggressive towards us, it's awful. You know, it hurts us. I think a lot of us, because we take it personally. A lot of people do. I know I do when people are mad at me. And so I would say that, you know your person better than we do. And so if you come from a place of you're wanting to do what's best for that person, and that is your main objective, and that's what you keep saying, like, I just want to do what's best. I want to make sure I'm making the best decision. I want to feel good about this decision, and I don't understand. Like, you can just say, I don't understand. Can you explain that in another way? Can you tell me one more time, like, what you mean by that, or what my options are? I think you have to be willing to ask them to repeat themselves and explain things in a different way, because I catch myself using medical terms sometimes in the ER because it's faster. It's just part of my brain, right? It's just part of the way we speak. And so asking for another explanation. And then the other thing is that if you are going into a visit that you know you're going to, like, you've chosen to come to the emergency department, have questions that you want answered. You know, you're coming there for a reason. This is the way I think about it when I'm approaching a patient's room. I'm like, what is their motivation for being here? What is the problem that I need to address? What are their questions that I need to answer in order for them to feel good about this situation, right? And if you know those things and you can communicate those things, then we will have better communication. So that was a lot, but switch your doctor if you need to.
I think like, yeah, I wanna like chime in on some of that stuff, because obviously, a lot of what we're talking about here is in the hospital or in the ER. But the fact is, these rules apply in any healthcare situation. And I literally like had written down, I'm so glad you said that, because I had written down one of the points that I wanted to talk about today, is that sometimes it takes a minute to find your person. And that is true in work, it's true with friends, and unfortunately, sometimes it's true in healthcare too. But it is important that we have trusting relationships with our healthcare providers, because it's the only way that we can be open and honest with them, right? So, you know, when you're thinking about your primary care doctor, if you don't have a trusting, open, honest relationship with the primary care doctor or the primary care doctor of your loved one, then maybe it's time to try another one, or, you know, shop around or something like that. It's like, you know, often on a therapy team and in rehab, you know, everyone is not the same, and everyone's personalities aren't always going to click. And, you know, some therapists are really strong in some areas and, you know, not so strong in others, and vice versa, right? So it's not uncommon to say, like, hey, you know, I've been working with this client for XYZ, and I feel like they just need a different person, and and we'll switch the therapist, you know. And I say that understanding that if you have a large team of therapists, that's possible to do. You know, in some places there might be one OT, there might be two, there might be one PT, you know, you might not have a lot of choices, and so you have to, you know, sort of more take what you can get. But there's nothing wrong with asking about your options. And, you know, I think that as long as, so like, here's how I might communicate if I wanted to change my therapist, or I wanted to change my doctor, or I just wanted to have a conversation with someone else, which I think is totally fair to do. But, you know, you make a good point, Brittany, that healthcare providers are people too, and they can get their feelings hurt, and particularly when we're under stress, we tend to take things more personally, and of course it's a stressful situation a lot of the time. So, and as much as, like, you know, we try not to take things personally, we try to, you know, let things roll off our back. Sometimes that's hard to do. So, and again, this isn't to put all of the onus on the patient or the caregiver or anything like that, but like, here's how I might approach a conversation where I'm asking someone if I can see another provider or something like that. You know, one is to just still be honest about it, right? We want to be honest, we want to be assertive, but try to avoid, you know, that kind of aggression. Even if maybe you are very understandably angry. And we know that there are situations which you should probably be understandably angry at. Like, we get that. But, you know, saying something like, I really hear where you're coming from. I'm feeling like I don't have a good understanding of what's going on here, or I'm feeling like maybe we're just struggling to communicate in a way that's productive. I'm wondering if it's possible for me to speak with one of your colleagues that you trust, or, you know, another provider that maybe you work with, just so I can try to communicate about this issue a little bit better. Because what it really comes down to is, you know, having good, clear communication. And good communication relies on both parties. It relies on both the healthcare provider to try as much as we can to communicate with you in a way that makes sense, that is meaningful, that is, of course, respectful, and empowering. And then, you know, from the other side too, also, you know, and I'd be interested to get your like perspective on this, Brittany. I have always thought of my relationship with the people that I care for as a partnership. Like, I'm not walking in as an authority on everything about that person. I have a specific set of skills which I am an authority on, but I'm not an authority on the way that person lives their life, who they are, what their routines are, what their home is like. I need a partner to learn all of that information so that I can best make recommendations and suggestions and plan for the best possible plan of care that I can put together for that person. But it's a partnership. It's not a one-sided thing.
Yeah, no, I think that's so true. And the culture in healthcare is changing. I think,
It
you
is.
know, it used to be that, you would go and see a provider, you know, a doctor or a therapist or whoever, and they would tell you what to do, and then you would maybe go and do it or maybe not, whatever. But I think, and they would tell you their opinion and give you their recommendation, and there wasn't as much back and forth about like, well, how do you feel about that, and does that work for you, and does that work for your life? And I think that medicine and healthcare in general, I think we're realizing that, you know, well, I think in a way we're realizing that we're kind of failing people by not looking at the big picture and their whole perspective on things. But, you know, from the way I was trained, so I've been an attending for 5 years, so I've been an ER doctor for 8 years, I've been out practicing on my own for 5 years, and the way that I look at my role, and I can't speak for all physicians because I really don't know what's going on in their heads, but I think a lot of us are like this, is that I give you the options, right? So you give me all the information I need to figure out what is most likely happening, and then I give you the options for what we can do. I will give you my recommendation. Like, you know, I say this all the time to people. I would be a bad doctor if I didn't tell you that you should probably have a CT scan of your belly right now because I'm concerned you might have appendicitis. You know, I would be a bad doctor if I told you that it would be okay for you to go home when you're having chest pain and you're sweaty and you really want to leave the ER, you know. And so for me, it's my role in the healthcare system, and how I think a lot of physicians are transitioning into seeing ourselves is more of that. Let us help you by telling us what you need, and then let us give you the options, and then we can kind of choose what's the best option for you in that moment. There may be a very clear option that you probably should take, but it is your choice. And so, and that it is more complicated with dementia, right? Because you're making these choices on behalf of someone else, and you're coordinating the care for someone else. And so if you feel like you don't feel confident in your person's providers, that's a whole nother layer of issue, right? Because sometimes your parent or your spouse may have been involved with this physician or this therapist or whoever for a while, and so then now you're coming into this relationship, and so that's a whole nother can of worms, really. But I think that people should know that it is always possible to get a second opinion. I don't think that if you go into your doctor's office and you're having a hard time communicating with them and you don't feel comfortable with what they're recommending for your loved one, that they will go and grab one of their colleagues and have them come in. It won't work like that. And the therapy world is different than the doctor world, you know. But you should, if you don't like what's happening, then do some homework, ask people around you. Ask for people who have actually taken care of people with dementia and maybe even enjoy it. Maybe even they like to see patients that have dementia. Mm-hmm. They're not put off by it. They feel comfortable with it, because that's a huge thing for all of y'all out there, is that if the neurologist you're going to, or the therapist you're going to, or the whoever you're going to take your person to doesn't do dementia, then you're going to need to find a different person. And some physicians don't feel as comfortable with it. So
yeah, that's such a good point too, because you're right, there's not everyone has worked with folks who have dementia, not everyone is knowledgeable about working with folks who have dementia, and certainly even if they are, not everyone loves to work with people who have dementia. I honestly, like, for me, that's one of my favorite things, but, you know, it was a really interesting experience when I spent a lot of time on acute care, having come from skilled nursing and worked in memory care a lot, and I worked with tons of people who had dementia, and I loved it. It was one of my favorite things to do. And then going into the acute care environment, where, of course, folks with dementia are still being widely served, but maybe not everyone in that environment had that same kind of background experience that I had. And it was really eye-opening to me, the difference, again, not because I was a better therapist or, you know, or certainly not like a better provider in any way, but just because I had a different background of experience, the way that I was able to interact with people differently. And, you know, suddenly Mrs. Smith or so-and-so who no one else could get up out of bed, you know, she's sitting up and she's in the chair, and it had nothing to do with anything except the fact that had experience working with folks who had dementia, and I also happened to really enjoy them, so I was able to operate from a positive space. And I think that when you are able to interact with someone who has dementia from a space of joy and genuinely wanting to be with them, even if they're very confused and they really don't know what's going on, they feel that coming from you. And they're still, you know, I say this all the time, people with dementia are still, they're people first. They feel what we're putting, they still feel they're having that experience. Even if 5 minutes later they're not going to remember it, they're having that experience now. So what we do matters in that moment. And I think finding a provider who understands that, and advocating for a provider who understands that can make a really big difference.
Yeah, I totally agree. I see people a lot of times commenting in the Facebook groups about their doctors and the neurologists and the people that they're going to get the workup and the diagnosis, and they feel like they're getting the runaround. And I would just want to shout, it's probably because those people don't either, you know, feel comfortable diagnosing this thing, or they don't want to. I mean, there's neurologists that don't want to deal with dementia patients. So anyway, I think that people should know that they can make a choice, but you may need to shop around and you may need to ask, you know, and that's the importance of tapping into your local resources. And that is another way that you can help us, is by being more educated about the disease and knowing what you have around you from a local standpoint. Like, I know you've interviewed someone from the Area Agency on Aging,
oh my gosh, she was
where you
so
are,
amazing.
but that is a fantastic resource. Yeah, and people don't know about it, and but that's something else. Like, you can educate us as a caregiver if you tell us, like, you know, the resources that you know about or you learned about, because then we can tell other people, and that you know, that's kind of an aside, but yeah, I think being educated is another way that we can improve communication. And there's so much education out there these days to help caregivers. I did want to ask you, can you tell, I know there's people that follow you and know you and obviously are in kind of the business that you're in, but can you tell us, you know, what occupational therapists do most commonly for folks with dementia, like what kind of stuff they help them with, and then how you are different than a physical therapist? Because I think a lot of people don't know that, and I think some people would like to hear that information.
Yeah. So, no, thanks for asking, because I think you're right. Lots of people, occupational therapy is a field that's not well understood. Even though I guarantee everyone has probably interacted with an occupational therapist, but they probably just didn't know it. But yeah, so the best way that I could describe the difference, and obviously I don't want to speak on behalf of, you know, the entire profession or the profession of physical therapy, but, you know, the best way to think about the difference is kind of in the name. You know, physical therapists are more focused on those physical aspects, whereas occupational therapists, it's sort of in our name. We are focused first and foremost on occupation, and that's not defined as what you do for a living. It's not just what you do for work. You don't have to work to receive occupational therapy. It's sort of defined more broadly as what you do to kind of occupy your time, or what you do with your life. So my job as an occupational therapist is to help people do the things that they want to do, need to do, and have to do. And in order to do that, I have a really big toolkit that I can use to address lots of different things. So I can address the characteristics of the person, whether those be the physical, emotional, cognitive, or mental characteristics of that person, in whatever capacity those can be addressed, but at the very least to understand what the capacity of those things are in the individual. And then I can also help people to do the things that they want to do by addressing or making changes or adaptations in the environment. So making sure that their environment allows them to do the things that they need to do. And then, of course, looking at the occupation or the activity or the task itself that someone wants to do. So we can modify an activity in order to make it so someone with dementia can participate in something that maybe is challenging for them now, either by changing the physical parameters of that activity or maybe making it less cognitively demanding. So for how I would work with someone who has dementia in the same way that I would work with many people, right? By kind of assessing where they are right now, understanding what kind of dementia that person has and what the likely challenges that they have and that they will have going forward as a part of that, but really keeping my eye on the prize there, and the prize being, for me as an occupational therapist, what does this person need to do, want to do, and have to do, and how do I help facilitate their ability to do those things as much as is possible. So it's kind of a big job.
Yeah, I can see that. I can see what you do for so many positives to it, and so many ways to get to you. Get to you after some sort of injury or accident, hospital stay, or even just trying to be more on the preventative side and more in the education and learning how to keep someone safe at home and those kinds of things. So, I think there's so many things that people could learn from you to take better care of their person.
Yeah, and I'll give just another little plug for my profession. If you're interested in occupational therapy, you can always go to the AOTA's website. That is the American Occupational Therapy Association. It's aota.org, and they have lots of really good resources and education about the profession to help you learn about education and all kinds of other things. So thank you for asking me that question and allowing me to plug for occupational therapists. I appreciate that. It is getting a little late probably here. We've been and the thing is, guys, like Brittany and I could just do this.
I know, we could talk
for a long time. But I wanted to give a couple of concrete tips that people can use. So one that I had is keep a running list of your questions. So whether that means that you keep a notepad and a pen on you and you write things down as you think of them, or you're dictating it into your phone, or whatever works for you, just keep a running list of your questions. Because one, if you're anything like me, you might think of it and then 5 minutes later you will not remember anymore. You should see, I have notepads everywhere that are just full of thoughts, because I'll forget them if I don't.
No, I have my computer, I have my phone.
Everywhere. So keep a running list. And especially as a caregiver, you've got so much going on. You've got so much on your mind.
Yeah.
Don't, if you think of it, just write it down, jot it down, or something that will at least jog your memory for it. That way, if you have a planned visit coming up, you can make sure that you ask all those questions. If you end up in an emergent situation, maybe that's a place to start from. You could also keep a list of some of the challenges that you are having. So if you know, if you notice, because we don't always, and a lot of times it can help direct your healthcare provider to ask the right questions. If they know what you're struggling with, that'll give them somewhere to go from, or it'll tell them oh, well, you don't need me, you need this other person. So if you just have, don't even worry. You don't have to know if it's going to be relevant or not relevant. If you're having a challenge with something, write it down. Keep a running list of that. And again, if you're in a situation where it's planned or unplanned, you're going to have that there to reference, so that frankly, when the occupational therapist walks into the room and they start asking you a lot of questions, you have something to go off of. Instead of just saying, oh, we're having a really hard time, which is an understandable answer, you can say, particularly to maybe a provider who's not going to probe as much. Maybe they're not going to ask as many questions. Maybe they're in a rush. They're not going to spend that time. And let's just be honest, that happens, So if you have a list, you can say, well, it's really a struggle, but here are 5 things that we're really having a hard time with. Then that provider is going to go, oh, tell me about those things. and you're going to have their attention. You're going to be more likely to get an answer about those things. So a running list of questions and a running list of problems or challenges that you are seeing, either whether it's a problem for your ability to provide care or things that you're seeing coming up with your loved one.
Yeah, I think that those things are great because I talk a lot about anticipating and planning, and that's actually a concrete action on my anticipation and planning problem. So I love that, writing down your questions, because we forget the questions that we want to ask. That's normal. And then, yeah, absolutely having a running list of what you're struggling with, because then, the problem is that as you're a caregiver, a lot of this stuff becomes normalized to you, becomes routine to you, and you kind of forget, you adapt, and you kind of, I don't know, you create a way to kind of fix it in a small way, but it's still always a problem. So like something that's always kind of nagging at you, I always tell people, if that thing is nagging at you, that could potentially create a bigger problem down the line. Say your person is wandering, or they're tripping over that rug or something, those are things to kind of jot down and be like, okay, now today I actually have 5 minutes. Let me look down at my list and see, is there anything I can actually take action on? But that can help a provider like you, potentially me, it just kind of depends on the situation, but in the emergency department, help you anticipate something that could be coming. Because like for me, if you tell me that your person's been not eating or drinking as much recently, and that's a problem that you've been having, that shoots off a cascade of all kinds of things that I need to go looking for. So I think that's great advice. I would say, when you come to see any providers, definitely have, and this maybe not as relevant for you, but all the medications and all the paperwork, I just take it everywhere you go. So any advance directives or medical power of attorney or whatever gives you the power to help this person make medical decisions when they can't, those documents, and then your medication list. Like, it is so important to have an up-to-date medication list. It makes a world of difference. And every adult human should know what medications they take if they're not cognitively impaired. That's something that we all need to take ownership of our medical issues and know what medications we take. So I wrote down that the medications and paperwork tell us they have dementia. We need to know. And then the last thing I wanted to talk about is goals of care. And that's something that is a big picture thing, and I could talk about it for a long time, but we need to know as medical providers how aggressive we need to be with someone's care. And that's basically how you can think about goals of care from a big picture standpoint. Does this person want every maximal medical treatment done to them? Is their focus and any intention of treatment comfort and not prolonging someone's life, or do they fall somewhere in the middle? And I think if you can pick, we can all do this now. Like, you can choose that category for your person or talk with them about what they want if they're still early enough and able to do so. But if we don't understand where we're operating from, then we're not going to make appropriate medical decisions and treatment decisions. Even therapy decisions. Like, we can't create a good plan for you if we don't know what our goal is. And so if there's anything I tell people that they need to do is we have to know what goals of care are. And I talk about this a lot online, so you can just follow me.
Yeah, I was going to say, like, if you want, and I don't think that the importance of that information and that topic can be overstated. And Brittany is obviously an expert on this, so like, if you're someone who is watching this because you follow me and you want more information about that, then I highly recommend, like, connect with Brittany, follow her after this ends and the recording of it is posted. I'll put for all my stuff, I'll put where you can find Brittany, so that you can go follow her, because she really is a wealth of information. And sometimes you don't even know that you need this until someone is talking about it, but and then you're like, oh, okay, this is really a good thing. Like, I promise this is a good thing. Frankly, even if you're not caring for someone right now, this is just good stuff that we should all know and be aware of and start to take responsibility for, because it does make a really big difference in getting what you want at the end of the day, which matters.
That's
which matters.
It matters. It absolutely does. It is like we do this for you, right?
It's actually for you. Promise.
Yes, it is. It's like the reason that healthcare exists is to help people stay healthy and live longer and better quality of lives. I mean, the monster that it's turned into and all the structural issues and all of that, I mean, but the people working in it, the people like you and me, we want to do what's best for people. And I think the majority of people that are in healthcare have
Agreed.
that motivation. And I do think that, as you go through, you might get a little salty and crispy around the edges and, but it's because of the stressors that are put on us as providers in caring for people and seeing how the system is broken and it's hard to navigate. So that's why you and I are out here doing this type of work, because we really just want. Thank goodness for the internet.
Thank goodness. I mean, sometimes I say, I realize I'm on the internet a lot. Sometimes I say thank goodness for the internet, and sometimes I think, ooh, internet. Oh, internet.
Yes. You can share a lot of information.
Yes, but good and bad.
bad.
But yeah, I think you're right. I mean, you and I wouldn't be able to do this without these kinds of platforms. So
yeah.
That's pretty cool, actually.
Yes, so
did you have any questions come in?
I don't have anybody. I have some people saying hi, and then I actually wrote a comment. I wrote tips coming because I was gonna, when I talk back about this later, I was gonna say, you can listen to us chat about all this stuff, but if you really want to get to the meat of it, then you can go to that point.
Okay.
So, but yeah, I so much appreciate you for doing this with me.
Likewise.
And we'll do it again hopefully at some point and come up with another topic. And if people are watching this and they have an idea of something that they want us to speak to, I'm sure that we could coordinate our schedules at some point to do it again.
I would love to. And likewise, if you're watching it live now or you're watching the recording later and you have a topic that you want to hear about or some questions or something, if it's something that we can talk about in any kind of educated way, then we'll do our best to make that happen for you. So let us know.
Yeah. Yes, let us know. I see there's 3 people watching. Hello to all of you. If you have any questions, now's the time to pop it in because we're about to sign off.
We're about to sign off. It's time to go watch Stranger Things.
Oh, nice. It's raining here. I think I don't know what I'm gonna watch. I've been watching F1 lately.
Oh,
on Netflix.
Drive to Survive.
Ooh,
that is good.
Yes,
that is good.
It is good. It's I've never really been into racing, but my aunt told me about it. My uncle is very into racing, so but it's so good.
I don't care about racing at all, but it's just a great TV show. It's very juicy. It's like the one live or reality TV thing that my husband would ever watch with me, so we enjoy that one together.
Yeah.
Okay. All right. We're going to go ahead and sign off now, everyone. So, like I said, if you have any questions, you want us to do this again and talk about something else, share it in the comments later. And, thank you.